So next on our series on the changes between the 2026 CDC vaccination schedule and the previous schedule and the American Academy of Pediatrics vaccine schedule for kids, let's talk about the hepatitis A vaccination. So hepatitis A is a really interesting kind of unsung hero in public health, unless you're in public health. It was the actual largest, most successful public health campaign in the United States. That's why a lot of people don't know about it or don't really see the importance of it. Hepatitis A is a virus that is spread like a stomach bug. And so you get it usually from foodborne illnesses or people not washing their hands after going to the bathroom. It's spread by what we call fomites, which is from the GI tract spread out onto surfaces. It's extremely contagious. It does have areas of outbreak. So there are certain areas that are high risk compared to other areas. So there were certainly areas that were higher risk. It was a major cause of acute, meaning acute onset right then, liver failure in children. And it was miserable. It caused a lot of increased hospitalizations, hundreds of thousands of hospitalizations a year, a lot of unnecessary treatments, medications, time off work, shutting down daycare systems and schools. And it's a big issue public health wise. So in the late 1990s, early 2000s, the hepatitis A vaccination was created. And they initially, again, just like a lot of these vaccinations, went after just high risk populations. So certain states that had a larger amount of outbreaks were given the vaccination first. And it was extremely successful. Even one vaccination during an outbreak had a significant reduction in the virus spreading, as well as complications, hospitalizations, and long-term side effects. But because of that, they started to notice that it was kind of evening out the playing field. It wasn't shutting it down because people are moving from state to state, people are moving around, risk factors change. And so all of a sudden, areas that weren't deemed as high of risk for hepatitis A were having thousands of people who were admitted to the hospital getting hepatitis A. And it was like, hang on a second. They shouldn't have to suffer from this when we have a very safe and appropriate vaccination. And so in 2006, every state adopted a universal hepatitis A vaccination for children at 1 and 2 years of age. One vaccination is great during an outbreak to help shut it down, but 2 gives you 15 to 40 years protection from hepatitis A. Since we did that, there has been a 99.5 reduction in hepatitis A in the United States. Again, this is the most successful public health campaign when it comes to vaccinations in U.S. history. It is extremely safe, it is extremely effective, and now it's become so effective that they want to go backwards. So what their recommendation is to change it back to shared decision making. So you can get it if you want it, but it's really just for high risk areas. Well, first of all areas were deemed high risk because no one should suffer from an illness that can cause acute liver failure when there's a safe and effective vaccination at preventing it. So one person dying or getting liver failure from hepatitis A is unacceptable in the United States. But we already did that. We went to the non-universal vaccination and people still suffered. And so since 2006, we have almost completely eradicated hepatitis A in the United States. And we have 20 years of data to show that this vaccination is very safe, very well tolerated. I've given thousands of the hepatitis A vaccination myself, and I've never even seen a side effect from the hepatitis A vaccination. And so again, in public health, we don't go backwards. We've already tried this with some of these vaccinations by just giving it to high-risk people, and people unnecessarily suffered. So this vaccination should continue to be for everyone at this time. There was no science that said, hey, we are now at a point where we can back up with our vaccination. We were not there yet. This was a political decision based on them wanting to change some recommendations. So they went after the lowest hanging fruit, the ones that people may not notice as much. So science didn't support this. No doctor in the United States supports this. No medical association in the United States supports this. There's really good data behind the hepatitis A vaccination safety and efficacy, and it really should be for every single child. If you have any questions, please talk to your medical provider, but I'm certainly here if it's more comfortable to ask these questions online. And if you have anything that you want to talk about, I can try to make another video as well. If you're interested in each one of these changes, I will put these videos in a folder so you can listen to all of them and then take your questions to your provider and say, hey, I want to make sure that this is still right for my child, but our recommendations as your pediatricians and those that care about the health of your child as well as the health of the children all around you, these vaccinations are still for everyone. Take care.